A surge in cases of the flu-like human metapneumovirus, HMPV, in China has raised fears of another COVID-style pandemic. Images of hospitals overrun with masked patients have circulated widely on social media, but health experts say HMPV is not like COVID and point out it has been around for many years. They say China and other countries are simply experiencing the seasonal increase in HMPV typically seen in winter. What is HMPV? What are the symptoms? And how does it spread? First identified in the Netherlands in 2001, HMPV spreads through direct contact between people or when someone touches a contaminated surface. The virus leads to a mild upper respiratory tract infection for most people. It is usually almost indistinguishable from flu. Symptoms for most people include a cough, a fever, and blocked nose. The very young, including children under 2, are most vulnerable to the virus. It also poses a greater risk to those with weakened immune systems, including the elderly and those with advanced cancer, according to Xu Liyang, an infectious diseases specialist in Singapore. If infected, a small but significant proportion of immunocompromised people can develop more severe disease where the lungs are affected, with wheezing, breathlessness, and symptoms of croup. Many will require hospital care with a smaller proportion at risk of dying from the infection, Dr. Xu said. Why are HMPV cases rising in China? Like many respiratory infections, HMPV is most active during late winter and spring. This is because viruses survive better in the cold and can pass more easily from one person to another as people spend more time indoors with closed windows. In northern China, the current HMPV spike coincides with low temperatures that are expected to last until March. Many other countries in the northern hemisphere, including the U.S., are also experiencing a growth in rates of HMPV, said Jacqueline Stevens, an epidemiologist at Flinders University in Australia. While this is concerning, the increased prevalence is likely the normal seasonal increase seen in winter, she said.